Hello, Mr. Jones.
Hello, sir.
I'm Dr. Thompson, one of the junior doctors in this pediatric surgery department. You are welcome to the clinic.
Thank you very much, sir.
Okay, good to see you. I can see that you are here with your son.
Yeah, I'm here with my son Jerry.
Okay, how is Jerry doing?
Jerry is not very well.
Okay,
Yeah, he has some pain in his left ear. Yeah, he actually had fever and pain for 3 days now in his left ear.
okay,
And when I went to check him this morning, I realized that he had some discharge on his pillow.
okay,
However, the pain he said had reduced.
okay,
My worry now is that I think that Jerry has a hole in his left ear, and that's
okay,
why I'm here this morning, doctor.
okay. Mr. Jones, I can actually see that you are worried, and we'll do all our best to make sure that Jerry is fine. Okay?
All right, doctor.
Okay. If I may get you correctly, you said that your son Jerry had a fever and a pain for some time, and this morning you saw a discharge on the pillow. Am I correct?
You're correct, doctor.
Okay. In order to actually know what is going on, I would like to check Jerry's ear. Is that what you think we can do?
Well, doctor, Jerry still has some pain in his ear, and I think this check might worsen the situation. Can't we just give Jerry drugs and then we'll be on our way?
Well, Mr. Jones, I can say that you are worried and you are in fears, and I can assure you that the examination is not going to be painful. It's just an instrument that we are going to use just to see through what might be going on in the ear. Is that okay, Mr. Jones?
Well, if you assure me that the examination will not worsen his condition, then we can go ahead with it, doctor.
Not at all. It wouldn't worsen the condition, okay?
All right, doctor.
Okay. From what I can see from Jerry's ear, your fears and your worries are actually valid. There is a hole in the ear which would have been as a result of the pressure that the discharge mounted on the ear. But that should not alarm you. You don't need to be worried. We are going to treat Jerry, okay?
Okay, doctor.
Okay. Do you have any worries?
Well, doctor, with a hole in the ear now, would we not need to do an X-ray or do some blood tests to further confirm what is wrong with Jerry?
Well, Mr. Jones, I'm really happy that you are so concerned about your son, Jerry. But the X-ray will not help us to make any diagnosis nor treat your son. And we are going to do some blood tests, just like an ancillary investigation, like full blood count to check Jerry's level. But the most important investigation we might consider doing here, it's what we call a swab test. We are going to take a swab from the ear and culture it. It will help us to know which organism exactly is causing this condition, and it will help us to select the appropriate antibiotics for us to use for the treatments. Are you with me, Mr. Jones?
I'm with you, doctor. I'm with you, doctor. So you have just said that we will not need blood test or an X-ray. However, we're going to have a swab test done for my son. Is that correct?
Exactly, Mr. Jones.
All right, doctor. I think I can work with that.
Okay. Um, we are going to give your son some antibiotics that he will take for like a week, and we'll give your son 2 weeks appointment. After 2 weeks, you people should we will come back or recheck Jerry again to be sure that he's perfectly okay. Is that okay with you, Mr. Jones?
That's okay with me, doctor.
Okay. Do you still have any other thing that you want us to discuss?
Well, at the moment, doctor, I think you have addressed my concerns and I'm very okay with what you've said, doctor.
It's all right. It's all right, Mr. Jones, and I'm happy. We'll be able to help you. We'll see you in next 2 weeks. Okay.
All right, doctor. Thank you very much for your
Okay.
time.
Thank you very much, Mr. Jones. Bye.
Bye, doctor.
Right. Now let's assess this candidate presentation. For assessment, there are 9 criteria used by OET to analyze your speaking test. We are going to use them one after each other. We have the linguistic criteria and we also have the clinical criteria. The first criteria on the list here is fluency. If you look at this candidate's presentation, the candidate was to some extent very fluent. He was able to make his presentation without pausing, without looking as if he was having thought block or couldn't remember what he was trying to say. Although there were occasional hesitations, which I believe the candidate would have done better. But the truth is this, even for the native speakers, they tend to hesitate too. Hesitation per se in English language is not a problem, but when it becomes too obvious, that's when it affects um, your speaking. The second criteria we look at here is intelligibility. When we talk about intelligibility, how clear was this candidate in his presentation? Were the pronunciations very okay? Were they very clear? For this candidate was to some extent very clear. Most of the words, they were well pronounced, they were pronounced correctly. Please note that the accent of the candidate is not part of the criteria. We all have different accents. As a Nigeria, you have a typical Nigeria accent. From those from India, you have your own accent. We all have accents depending on the country you are coming from. So you don't bother about your accent or try to fake your accent or try to mimic the breathing, because by doing that you will become less natural in your speaking. Note that the more natural your speaking is, the better your score will be. The next criteria we look at here is what we call appropriateness of language. The diction that this candidate used was very okay. The candidate tried as much as possible to use diction in line with medical field, and not just using this diction. The diction, they were appropriate, and the patient was able to understand. He tried as much as possible to explain things in layman terms. Now, the next criteria that they also use for your assessment is what we called resource of grammar and expression. Where your tenses, were they correct? Your articles, were they correct? The way you talk, your expressions, maybe use some idioms, were they all right? For this candidate, I think this candidate actually did a very good job in these aspects. Now, let's look at the clinical criteria. For the clinical criteria, the relationship building for this candidate was top notch. The candidate tried as much as possible to greet this patient at the beginning of the presentation, tried as much as possible to familiarize himself with this patient by introducing himself to this patient. And also, this candidate also tried to call this patient by his name throughout this presentation. This is very, very advisable. Try as much as possible when you are making this presentation to, at interval, call the patient by his name. But that does not mean you'll be repeatedly calling the patient's name unnecessarily. But this, when you call the patient's name at interval, it helps to buttress to foster the relationship that you have with the patient, and it also helps to build the relationship you have with the patient. So for relationship building, it starts from the beginning of the presentation. How you greeted this patient, how you welcome this patient, how you make this patient to feel comfortable. So these are the things that they look out for in the relationship building aspect. Now, when we talk about understanding and incorporating the patient perspective, this candidate also did a fantastic job there. He tried as much as possible to empathize with this patient. Occasionally, he tried to see things in the patient perspective too, and also try to find out the patient's opinion. These are some of the tricks that you use in your speaking. Then this candidate, another thing that this candidate did very well is providing structure for this presentation. As you can see, the candidate had a structure. He starts from the beginning, trying to know the presenting complaint. He went on to talk about the to examine this patient and the examination findings. Then what the candidate did again was to talk about the tests that were to be done for this patient, and then finally the candidate talked about the treatment. This is a kind of providing structure in your speaking, and when the candidate finishes one point, he tried to bring the patient in for the next discussion. So these are some of the tricks that you use for you to score above 400 in OET speaking. Now, another thing that this candidate did very well. This candidate tried as much as possible to gather information from this patient, from the interlocutor. He tried to ask questions, okay, and occasionally, even when the doctor or the candidate here was trying to like dish out some tests and carry on examination, he tried to ask the interlocutor or the patient, do you think this will be comfortable for you? Do you think it's okay for me to do this? Do you understand? This is a nice way to actually to approach your speaking. These are the things that they look at for in your clinical criteria. Now, the last point, the last thing that this candidate did very well is how um, this candidate tried to give out information for this patient. He tried to explain things to this patient in a layman format. He tried to use a very good tone to explain things without being angry, even when the patient was angry. He tried as much as possible to be cordial with this patient. Okay, so these are the things that they look out for in your OET speaking. Try as much as possible to work on these criteria and get them right. It's actually very easy to score over 400 in OET speaking. It depends on, were you able to meet up with all these criteria? If you give them what they need, they will definitely give you your score. Okay. If you really enjoy or you like my tutorials and video, kindly hit the subscribe button and also like my video, share my video with your colleagues so that they will also benefit. If you have any question or anything you want me to clarify further, you can drop them on the comment section below. If you want to reach out to me, you want to contact me, get you can get in touch with me through this means. Thank you very much. Thank you for your time, and I wish you the best in your exam. Bye.